Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am your host. And I am delighted to have with us our next guest, someone who's been a champion in more ways than one. Dr. Mary O'Connor is a nationally recognized orthopedic surgeon, a former Olympic level rower, and now a healthcare reformer who's trying to fix a broken system. This conversation is going to take us from Olympic dreams to Mayo Clinic leadership to the front lines of healthcare disruption at Vori Health. Mary, it's a privilege and an honor to have you with us. Thank you so much for being here.
Right. Delighted to be with you.
Awesome. So listen, I have to go right to the Olympics because this has probably trailed you for your entire life. So, growing up as a kid, and we're of the same generation, the 1980 Miracle on Ice was maybe the single greatest memory of any sporting event that I have personally. It really hit so close to home because there was a rivalry between the U.S. and Russia. And my son actually went to Boston University. He studied engineering there. And as parents of a child who went there, parents of the Alumni Association, we were invited to a special event that was actually hosted by Mike Eruzione and Jack O'Callahan, who were both on that team and both had gone to BU. And it was hosted right here in Manhattan at the New York City Athletics Club. So it was a small, little, intimate setting. And we had kind of a front row seat for them describing what that achievement was like. Yeah. And folks, if you haven't seen it, go back and see it. A lot of our audience is younger; they're not going to know what the hell I'm talking about. But it was amazing because what they described is that they had like a snowball's chance in hell of pulling off what they pulled off. And they were basically a bunch of kids that were playing against professional men. And they were just like, you have no idea, how the odds were stacked against us. So when I did a little bit of homework because you were coming on, and I said, I asked like ChatGPT, what year did Mary O'Connor compete in the Olympics? And then it said 1980. And I was like, what? 1980. And then I went, a little deeper and I found that because it didn't register with me because now the Olympics are kind of every 2 years alternating fall, summer, winter. And so I said, how could she compete in 1980 if the Miracle on Ice was 1980? And so tell us the story. You actually didn't have an opportunity to compete. What happened?
So that year, the Summer Games were in Moscow. And, of course, Russia had invaded Afghanistan, and President Carter had decided that the American athletes would not compete in Moscow as a way of, punishing the Russians for invading Afghanistan.
Unbelievable.
And of course, we stated our case that, the Olympics should be above this political kind of conversation, and that wasn't heard. But if you want to know, actually, one of the most painful events of that summer was the fact that a lot of my friends on other international teams, because I had met them in 1979 at the World Championships where we set a world record, and, it was just so I knew these athletes from Canada, from New Zealand, and then they boycotted under pressure from the United States. Yeah. And that was so, I felt like, so we went over that summer to do our trips and races like we would have had we been going to Moscow. And I felt so personally responsible. I'm so sorry. It's one thing for my president to mess with my dreams, to shatter my dreams. Yeah. But for my president to shatter your dreams, that, but it was what it was. You have to, you learn to get over the disappointments and move forward.
Well, so it's very telling that it speaks to me about your character, because I think most people, maybe myself included, would just be like, oh, woe's me, because think about it, and you hadn't been kind of pursuing the Olympic dream from a very early age. Like some people come out of the womb and it's like, you're going to the Olympics, right? So they're training very early on, but still there was, describe for us, what is that like? What is it like putting in the work?
Well, you have to go back, and when you say like they're born out of the womb, like today it's so different because today there are so many sports opportunities for girls, right? But I am a Title IX product. When I was in high school, we had no sports teams.
What's Title IX?
Title IX was the federal legislation that on the basis of sex, that educational institutions receiving federal dollars have to provide equal opportunity for female athletes as they do male athletes. And that then created the growth of sports for girls and young women in this country. And we have become the training center for the entire world. So like in my sport of rowing, if you look at high-level collegiate teams, you'll find a lot of them have international athletes. In fact, I think the men's championship 8 this year had one American-born rower.
What?
Yeah. So why do they come over here? Because we have great training facilities, because we've invested in the infrastructure. Anyway, that's a sidebar. So back in the day, there were no high school sports for girls. So when I went to college, I had the opportunity to start rowing, and I loved it. And of course, you got to work hard at it, and you have to sacrifice and be committed to it, and with luck and commitment, coaching, all supportive parents, right? You can do those things.
Amazing. And so you went to Yale?
I went to Yale.
And what was that path like? Did you have Yale being one of the Ivy League schools, not an easy school to get into? Did you have an in? Was there pedigree in your family? Yale alums, contributors?
No.
Or was it how did it work for you?
So, I come from very middle-class upbringing. My mom worked as a nurse for years and then went into real estate. My dad worked in he was a machinist. He went to college for 3 years, ran out of money, never got his degree. Worked 7 days a week all the years I was growing up. Time and a half on Saturday, double time on Sunday. I mean, my parents sacrificed. I'm one of 6 children. And education was our ticket, right? Education, they emphasized how important education was. And so I loved school. I was a good student. I got good grades. I was a foreign exchange student. I lived in Belgium for a year, my senior year of high school. That was another great experience. Anyway, I came back. I applied. I got into Yale. And I went there, of course, on financial aid because my parents didn't have money.
Right.
And it was great. It was amazing. And I got there and decided I wanted to row. And that's probably when I first kind of experienced unequal treatment and disparities, which has kind of been a thread that's followed me throughout my professional career. I chair a national nonprofit called Movement is Life. We're focused on addressing healthcare disparities, particularly in the orthopedic space. So when I went to Yale and started rowing, we didn't have a locker room at the boathouse.
Oh.
And of course the guys did, right?
Well, where did you change?
We didn't. We had to get on the bus at campus. The boathouse was a 30-minute bus ride. So we'd bus out to the boathouse. We'd practice. We'd sit on the bus, cold and wet and sweaty, waiting for the guys to get showered and put their dry, clean clothes on, get in the bus, then we'd go back to campus to get to the last open dining hall for dinner, right?
That sounds a little backwards to me. Like, what happened to chivalry and gentlemen?
No, it's not their fault. It wasn't their fault that
Right.
there was no locker room for us. So,
Right.
So that spring, our captain decided, we were going to do this protest. It's somewhat famous in some circles. So 19 of us marched into the
Not that it
athletic
matters,
director-
but was your captain male or female?
Female. This is
Female.
the women's rowing team.
I mean, the captain of the team was
captain
also
of-
a student.
Yes.
Okay.
So we're all
Not the coach.
No.
Okay.
We couldn't tell our coach anything about this.
Okay.
No, he went and, rumor has it, had a few drinks after he found out what we did. So we marched into the athletic director's office, stripped, had Title IX written on our bare chests and backs, and our captain read a statement to the Yale women's athletic director that started with, "These are the bodies that Yale is exploiting."
Wow.
Yeah. So we had a photographer from the Yale Daily News there, and there was a story and picture. You can Google it.
Wow.
From our captain from behind. You can see Title IX on her bare back, and the athletic director, who is a woman, is standing there with her arms folded and her head down, like the most closed body posture you can imagine.
Right.
So the story was then picked up by the New York Times because all those Yaleys in New York want to know what's happening on the home front.
She was just tossed a political hand grenade.
Yeah.
She was like,
and the International Herald Tribune.
Yeah.
And then the university was embarrassed.
oh,
And so miraculously, somehow, the stars aligned that there was an addition on the boathouse by the following spring.
oh,
Exactly.
yeah.
Now, my perception was, wait a second, here I am at Yale, one of the best universities in the country.
Yeah.
A university with significant financial resources.
Sure.
And I'm supposed to say it's okay that we don't have a locker room at the boathouse?
Right.
Like, if I say that's okay,
Yeah.
what does that say about me?
Yeah.
That I don't value myself or my rights? So our protest has been heralded as the first stand for Title IX in college athletics.
That is amazing.
Yeah.
Really.
So we got our boathouse. We were extremely successful as athletes.
Yeah.
Many of us on national and Olympic teams. And so I'm very proud of our efforts. Now, of course, I did not tell my parents we were going to do this. my father, when he found out, he was like, "What?
You did what?
You did what?" And I think, there were a couple women on the team
Yeah.
that declined to participate.
Okay.
And I think, talking to them, they were afraid they were going to get thrown out of school.
Sure.
Actually, that thought never occurred to me. It
Okay.
wasn't until afterwards I'm like, oh my God, what if I get expelled? That would be a very bad thing.
Well, even though you're at Yale, you're very young. You've got a lot.
yeah.
You got a lot of living and a lot of learning left ahead of you. You're very bright, obviously. But you know what though? In hindsight, do you have any regrets?
No, but it is a realization that when you're that young,
Yeah.
right, you really don't think about all of the potential ramifications.
Right. It's true.
I mean, I certainly didn't. And it all worked out.
Yeah.
And that was fine.
Yeah.
But, yeah.
Yeah, no, but I really admire that because so my favorite movie of all time is Rocky. It's the underdog story, right? It's the guy that never had any business being in the ring, who went the distance with the champion, and he doesn't win the fight, but no one had ever gone the distance with the champion, and that was his goal. So he achieved his goal, and it's truly a love story, but it's an underdog story. And I love when people stand up for what they believe is right. And that's exactly what you did.
Yeah.
And so that's awesome.
And that, so now that's kind of just translated into my health equity work and my entrepreneurial work. And
Yeah.
it's all, if we align, and you know this, right? The more we're aligned with our internal values, the more passionate we are about the work that we're doing. It's not work, right?
Correct.
Yeah.
Yeah. Yeah. It becomes a passion project, a labor of love. And that's really what it's all about at the end of the day. So you go through what did getting on the Olympic team look like? What was the field that you were competing against, and what is the selection process? What are the rigors that they put you through, and how do they because they have to distill, I would imagine, hundreds of folks that want to be on the team.
So it's a little different today compared to then, but in general, at least for the bigger boats, there's a selection camp. And the selection camp at that time for me was in Princeton. And you go there and you're there for 6-8 weeks and you're racing and training and doing what's called seat racing. And the coach is making a decision and people get cut. And then there's more cuts and then there's the final selection. And yeah,
wow.
It's intense. Yeah, I mean, that's what athletics is, right? Athletics is, you got the goal, you got to work towards it, and then you have to prove that you can produce, or you don't get selected.
Crazy.
And that's, right? That's it. And when we think about how you apply that in a professional sense, right? For most businesses, you got to do the same thing.
Yeah.
You got to be able to bring value to the company, and you have to be able to produce so the company can be viable and grow.
Right.
And hopefully the company's doing something worthwhile that's making the world a better place.
Right.
Yeah.
Amazing. And so, I think we grew up in a time where I think a lot of the social, racial, gender barriers started to break down. They still exist today, right? To be clear, like if we had a scale of 0 to 100, we're nowhere near 0, but we're a hell of a lot better than we once were, and certainly when we were growing up. So it sounds to me like even going back to your college days on the rowing team, you didn't even have a locker room, for crying out loud. So that's evidence of discrimination, in my view, right? So I would imagine that someone like you has repeatedly kind of been in this fight against you didn't unfortunately get to play on a level playing field. The cards were almost always stacked against you. And, what kind of lessons can you share with our audience about what that has taught you? And how did you find it within yourself to persevere and dig deep and overcome?
Well, Ray, it's, I guess it's just in my nature, I mean, the thing that athletics instilled, at least in me, is right. I've set the goal. I'm going to commit to the goal. I'm going to work hard to get to the goal. Now, am I going to need support and help along the way? Yes. You have coaches, you have your teammates, etc. Right? When I look at my career in orthopedics, and I've been blessed to have an amazing career in orthopedics, nobody gets there by themselves. And I was the first woman, like in so many professional organizations. It's crazy. But I didn't get there because I just wanted to be there. I got there because men, my male orthopedic surgeon colleagues, sponsored me for membership or sponsored me for leadership positions that allowed me to then move up and have those leadership experiences. So yes, I broke a lot of, barriers as a woman in orthopedics. And so it is better now. But the profession, unfortunately, like orthopedics, my profession remains one of the least diverse workforces in the medical profession.
Wow.
Okay.
What are the numbers?
We have the lowest percentage of women in any surgical subspecialty training program.
Wow.
So if you look at the percentage, right, there's a higher percentage of women training in urology, training in neurosurgery, training in cardiothoracic surgery, training in all these other areas than orthopedics. When women, 50% of the population, right, 51%, get lots of orthopedic issues.
Right.
But anyway, so I'm glad that I think I've been able to ease the path for those that have come after me.
But do you think is it because women aren't choosing it as a career path? And if so, is it just I don't know. Do you think they're making that choice based on their perception that it's a male-dominated profession, and it's therefore, why are they going to go into, why are they going to create more heartache for themselves?
Yeah. Well, it's multifactorial. People have looked at this.
Yep.
And some of it is in medical school. Young women in medical school are kind of given this message that orthopedics is too hard, or you've got to be big and strong, or you can't have a family and be an orthopedic surgeon.
Yeah.
So there are these subtle negative messages, right? Which I tell all the women, like, ignore, ignore, ignore.
Yeah.
Yeah. I have a family. I have 3 children. Like, you can do this.
Yeah.
And like, why would you want to be any kind of surgeon except an orthopedic surgeon? Like, why? I don't know. Why would you want to be anything else? It's the best surgical field.
Right.
So, So it has improved, and the percentage has gone up, but we're not where we need to be.
Gotcha. Very cool. So, I'm imagining, were you pre-med at Yale, or or were you doing? I don't even know how it works. Undergrad, then pre-med, then medical school, or what is the progression?
So I was a biochemistry major at Yale. Hadn't really decided when I went there that I wanted to do medicine, but I liked science and I liked working with people, so that was kind of a natural fit, right?
Yeah.
And then I took some time off from my athletic pursuits before I went to medical school.
Okay.
And so kind of after 1980, that was a big decision point for me because I had to decide, am I going to train and try to make the 84 team, as several of my 1980 teammates did, right?
Yeah.
Am I going to stick around for 4 more years, put the rest of my life on hold?
Yeah.
Because that's what you got to do, basically.
Right.
That has to be your singular focus. You have a job that's not, it's just a job to earn some money to support your training, right? But you are training.
Yeah.
Okay?
Yeah.
Was I going to do that for another 4 years, or was I going to move on with what I wanted to do professionally?
Right.
And I decided, you know what? It's time.
Yeah.
I'm going to go to medical school. I'm going to get busy on my career.
Yeah.
And so I didn't stay for another 4 years, as some of my teammates did.
That must have been a difficult decision to make. I'm sure I'm sure you struggle with that, because it's to come so far and then have politics get in the way must have been such a letdown.
What are you going to? I mean, you have to make the call.
You got to
make the call.
Yeah, and also, you were imagine in your early 20s, in the very early 20s in the 80 Olympics, and then you're 4 years older. Not that. If you're in your mid-20s, it's a huge deal. But for certain athletes, I'm sure if they were in their mid to late 20s and now they're in their early 30s, people have to face the facts. Like I know in the fighting game, like by your mid 30s, it's over. For the most part, it's just your body is equipped to be optimal when you're in your early to mid 20s, and you had other thoughts, though. You had a different direction that you wanted to head.
Yeah. So I don't have any regrets about it.
Yeah. No, it's an amazing accomplishment. Amazing achievement, really.
And honestly, it helped me get into orthopedic surgery.
Yeah.
Because back then, there were even fewer women.
Sure.
And, well, I don't know this for a fact. I suspect that the men who were evaluating me to select me could look at my Olympic rower accomplishment and say, wow, that's kind of cool.
Yeah.
Maybe we'll let her into the club. No, I'm serious. But what I learned from that, and I've had to select residents, fellows, faculty member. I've had to do a lot in my career of evaluating, hiring, selecting people.
Right.
And what I learned is, I look for the ability that someone excelled at something. Doesn't have to be sports. Could be anything.
Right.
Right? Could be baking, dancing, whatever.
Sure.
But if you're able...
Having a podcast studio.
Having a podcast studio, which is really quite... the listener... People can't see how decked out your podcast studio is. It's really quite professional. I'm very impressed. So...
I'll pay you later.
Yeah, okay. I look for the ability that somebody has demonstrated their ability to excel. Why? Because that tells me they've already got all the skills that they're going to need to be a great faculty member for me, a great fellow, a great resident, whatever. They've got discipline. They can roll with the punches. They're a hard worker. Or you can't get really good at something unless you have those skills.
Yeah.
So I'm like, okay, that's...
Yeah. So that the question on the tip of my tongue then is we're hearing so much about DEI, right? Diversity, equity, and inclusion. And it's, I think we went in our, culturally, it was a bubble that I think burst, right? We got into the whole woke movement. And I think, I don't think I'm, out there alone on a limb saying, I'm pretty sure that's over in terms of the whole woke movement. I think it kind of ran its course and people are done with that. But what I'm hearing you say is not that you valued, that you had to check a box to say, oh, we need another woman on our team, or we need another Asian on our team, or we need another African American on our team. Your criteria for selecting folks for the team was based on something that they had done. It's something that stood out about them that was merit-based, yeah?
Yeah. But I do think, the concept of the value of diversity, I think, has been a little lost. And I think it's still a very, very important concept. And I will give talks to orthopedic groups, residence groups about the importance of diversity, because that's what will create high performance teams. Okay?
Yeah.
All right. So one of the images that I have in my presentation, my slides, is an image of my son with the 1991 Acura LS trimline vehicle that I bought, that I gave to him when he was 16. I told you, we keep cars in our family for a long time. So I just finished my training. I got my first job. I'm on staff at Mayo Clinic in Florida, and I'm going to buy a new car, right? I always had used cars, hand-me-down cars. I'm going to go buy a new car.
Right.
And had 2 children at the time. He was our second child. He was 9 months old. And I wanted a car that was going to be the safest car for my children. So I wanted a car that had a passenger side airbag. This was back, first generation airbags. There were only 2 cars.
Sounds like a Volvo.
No, there were only 2 cars on the market at the time that had passenger side airbags. Mercedes and this Acura Legend LS, the top trim line.
Okay.
So I was in massive debt from medical school and residency. I couldn't afford the Mercedes. So I went and I got the Acura specifically for this safety feature. Okay. Now, did I know, or did anybody know at the time, that first generation airbag was going to kill children, women, and small men? No. So did Detroit invest millions to create a safety product that they knew were going to kill kids?
Right.
Women, of course not.
Right.
Were the engineers incompetent? Did they not know anything? Of course not. So then you say, so how in the frick did this happen? This colossal disaster of first generation airbags. Okay. Well, the design team, mostly guys. Now, if there had been more women on that team, mothers even, would somebody have asked the question, hey, what happens if my baby or my child's in the front seat and that airbag goes off? Even the guys, I don't know, were some of them fathers? Maybe, but did they think to ask the question? So this is like the perfect example of why if you don't have diversity on your team, you risk the airbag tragedy because your team isn't thinking about other questions to ask, which they would ask because of their personal experience and the life lessons that they bring into the conversation. So this is why we need diversity on our teams. If we want to have high-performance teams, if we want to solve problems, we need diversity of people in terms of their backgrounds and their experience and the way that they think.
Yeah, that's a great
Right?
point. 100%. Because you need that. It's almost like in this interview, I'm not going to ask you all questions that I want to hear. Yeah, Ray, of course, right. No, I want to have a conversation where there's going to be pushback in certain areas. There's going to be a difference of opinion. Something is going to be different. I'm going to ask you a provocative question because I want to hear what you have to say, and the audience hopefully wants to hear what you have to say. And likewise, if you surround yourself as a leader in any organization with people that are just yes men, yes people, yes ladies, you're not going to get where you want to go. You need to have people that have different experiences that can give you a perspective that is not your own. And that's going to really be where the gold is.
And, I think a lot about the way people think, their kind of personality styles and work styles. And I think that's really also equally valuable for the diversity on your leadership team. Like I tend to be a strong driver and more of an expressive, like vision and getting stuff done.
Yeah.
That's my passion space,
Yep.
right? If you look at people that are strongly analyticals, they're data people. They want data. And they can have trouble making decisions because they want more data, right?
Yep.
And then you have the amiables that are the people.
Yeah.
And I have learned in my my leadership experience that I need to flex my style when I'm interacting with those folks to make them feel comfortable and to get the most out of them, and then for our team to be the most effective, right? It's not their responsibility. It's my responsibility to flex to them. And I'll give you an example.
Yeah.
So one of my partners, one of my orthopedic surgery partners in my department was super, super analytical, right? And I'd be running the department meeting and I'd be in driver mode. I'd have, here's the agenda and here's the things we're going to decide, boom, 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 right?
Yep.
And here's the background information. And my expectation is I'm looking for us to make decisions so we can move forward with the plan. And this partner would consistently want more data. Oh God, it would drive me nuts, right? I what is it that you need,
Yeah.
Then I learned, once I started to appreciate, okay, he's this really strong analytical. And you know what? I'm not.
Yeah.
Okay? I don't go to the appendix section in general.
Right.
I read the executive summary. Executive summary is made for drivers. The appendix section is made for analyticals.
Yeah.
It's true.
Yeah.
So I started to get smarter. I would say to him before a meeting, now this took more prep work on my part, but it paid off.
Okay.
I would say, look, this is something I hope that we can make a decision on at the next department meeting. Here's the data that I have for it. You're so good at data. Would you look through this? Are there some gaps that you think we have so we can try and get the data before the meeting
Yeah.
so that we can make a decision? Okay, now I'm engaging him. I'm actually using his strengths to help me, right, identify if there are gaps. And now the world becomes so much more beautiful.
Yeah.
Right? Because now, and there are a few times when he's like, well, what about this? Maybe
Right.
we should try and see if we can get that. Oh, that's a really good point.
You were speaking his language.
But he helped me because he could see gaps that I didn't see. That's why you need all these people, the driver, the expressive, the analytical, the amiable, these personality types on your team. That's the work of a guy named Harvey Robbins, who was, leadership guru at the University of Minnesota for a long time.
Okay.
Who learned it by training covert CIA teams. Fascinating background.
Wow.
He just retired. Amazing guy.
Yeah.
But he's got some books. You could go find his books. the new why teams don't work, stuff like that. Anyway.
Yeah. That sounds fascinating.
Yeah.
Very cool. So you're on the path to orthopedic surgery. You had some folks, some men, who identified something in you that said, we need to support Mary.
Yes.
Because she's got the chops. She could do this, right? And so that opened some doors for you. And describe your first experience. You go through residency, right? And so talk to me a little bit about what that's like as a young doctor that's just cutting your teeth. That's just like, were there any moments where you said like, what the hell did I get? What did I sign up for here? What did I get into? Or was it more excited? Like, wow, this is, because we touched on it earlier. Like if you figure out something that you love to do and you're passionate, it doesn't even feel like work. Was it like that, or were there some hurdles along the way?
Well, there are always some hurdles along the way, but we had a great department. I mean, Mayo Clinic in Rochester, the faculty there, which were all men at the time, right? Top shelf, really top notch. And I probably had more trouble with surgeons, male surgeons from other departments than I actually did with the orthopedic surgeons. And yeah, but you roll with it.
Yeah.
Like, I mean, could I tell you stories of inappropriate comments and stuff like that? Of course, but like you just gotta, like, I don't know, maybe I just wasn't super sensitive.
Yeah.
I just like ignored that stuff.
Yeah.
I just put that in the garbage category.
Pay me no mind list.
Exactly. Like I'm not going to devote my energy to this. I'm moving forward. I'm ignoring this.
Yeah.
Yeah. Like I don't have time for it. I don't need it to suck up my emotional, spiritual, physical energy. Like I'm just
right. So what is it like you're in the setting? Like you're going through a ton of schooling. Like on average, I think it's like 14 years of school.
It's a long time.
It's a lot of time. But then, kind of describe your first days in a clinical setting where you're first boots on the ground, making rounds, seeing patients. I'm taking you back. What is that like?
I think more importantly is probably the transition when you go from you're done with your training. Now you're kind of the real doctor, right? So I was the first woman orthopedic surgeon on staff at any Mayo Clinic site.
Kind of a big deal.
Yeah, all because of the support from some of my mentors in Rochester.
You want to give them a shout out?
Bernie Morey, Franklin Sim, Douglas Pritchard, he's passed now, Mike Cabanella. There's just so many.
Yeah.
Tony Bianco, he's passed too. Anyway, so when you make this transition and now you're the surgeon, like you're responsible, you're making the decisions. You don't have the faculty member or consultant backing you up actually making the decisions. You're done with training.
Yeah.
Right?
Yeah.
That's probably the most stressful time. And it's good. You have to learn when to ask for help. And I was very blessed. So when I first started, my real job, right? One of my partners, Kurt Blosser, was kind of like my surgeon buddy. We operated on the same days. And when I had something really challenging in the hip and knee reconstruction world, because my clinical practice was tumor surgery, which is a whole nother orthopedic oncology. I took care of kids with bone cancer. Oof. Yeah, that was probably emotionally the toughest part of my job. And adults with cancer, and I did hip and knee replacement. Anyway, Kurt Blosser, master surgeon, and I learned a lot from him helping me and me helping him. He would have me come in and first assist him on complex cases. And that kind of transition, maybe for the first year, was so helpful to me. So you need to kind of say, okay, here's what I'm good for now, right? Because, and this is kind of one of the secrets that people don't want to talk about in medicine, especially, well, it's in surgery, but it happens in all the field. Like, you get so much better after you're out a few years. Like, I always thought that I am going to be the best surgeon I will ever be after about 8 to 10 years. And then I'm going to have this window where I'm spot on. Like, I'm at my peak.
Right.
And then I'm going to start to fade. And then I should retire. No, okay. I'm like this is the
that was the mindset.
No, this is the mindset because like I could see in younger faculty members that would come on. I mean, everybody goes through this. You learn from your experience as a surgeon, and surgery is a hands-on. Like, you got to do it to be good at it. You got to do it.
Right.
So my advice for people needing an orthopedic surgeon is go find somebody that's like a few years out from their training and not ready to retire. That's what I would do if it was me, which sounds crazy, but
now, are there some of your colleagues that might be still practicing that are listening to this saying, that's her opinion. Like, yeah, I feel like I'm better than ever now.
Well, the difference when I'll go to that kind of pre-retirement area is when you have actually the most wisdom. Like, you have the best clinical judgment because you've already learned from all your mistakes and all your complications. And there is no surgeon that doesn't have complications.
Yeah.
And those are so painful.
Sure.
And you have to... That's another part of the life cycle of a surgeon is you have to learn how to emotionally handle those things when they happen.
Yeah. Yeah.
Because they're tough,
Yeah. Well, so we went through two things with, more than two things now that I think about it. But when our son was born, when he was a baby, they diagnosed him in utero with subpulmonic sequestration. So we had a little separate piece of lung tissue that formed subdiaphragmatic. It was beneath his diaphragm, and they couldn't positively identify it on ultrasound, but it was maybe the first case where it was diagnosed via ultrasound. And so the thinking was, we have to go in and take it out. Like, we don't know what it is.
Wow.
It doesn't look, cancerous, but it could develop into something later. And so one of the hardest things that we've gone through is watching him get wheeled through the operating doors as an infant. And it was just, I was just a hot mess. It destroyed me as a parent because you feel completely helpless. And then fast forward, when he was 5 or 6, he had bowel adhesions. He was throwing up. We didn't know what was going on, and that was the story. So anytime you have abdominal surgery, I guess you run the risk of bowel adhesions. He went through that, and then he's 5 or 6 years old at the time. Now I loved him when he was first born, but now he's a human. Like, I have a relationship with this kid. So it was like extremely emotional. So as a surgeon, how do you, that must be tough when I'm sure you acclimate to it in time, but if you're dealing with children, I don't know if you dealt with children.
The children were, I remember, it's one of my mentors, Franklin Sim, one of the best orthopedic oncologists in the whole world. Okay. I mean, he master surgeon, particularly limb salvage in the pelvis. I was first author on a landmark limb salvage publication on our Mayo Clinic experience. He gave me that opportunity. Same thing I did with shoulder limb salvage. So, like, this is where mentorship and sponsorship really comes in.
Sure.
Right? He could have had some other resident look this up and do this research to write this paper.
Yeah.
But I had the opportunity to do it. And it helped set me apart and pave the path for my academic career. But I remember the children that I operated on, the ones who died. Like, I could just rattle off names. Oh. And they didn't die on the table, thank God, with me, but they died of their cancer. I came to realize that my job, my role is to do the best I can do for every patient. But it's not up to me, Ray, if they get better.
No.
It's not. It's up to Divine Mother, God, Jesus, whatever name you want to use.
Yeah.
Right? I don't determine if they live, they die, they get better, they get worse. My
Right.
job is to do the best I can to help them do that.
Right.
But it's really not up to me. And once I got to that kind of spiritual place, then because I had to,
Yeah.
like I had to figure out how am I going to like deal with this.
Sure.
Then it was easier.
The Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket cost for healthcare. Visit benefixa.com. So I would imagine, being an orthopedic surgeon, that a lot of what you see is trauma, right? Your bones are breaking and stuff like that. I mean, you mentioned oncology and I guess cancer wrapped around bones. Mm-hmm. But do you have anything that sticks out in your mind where you were like, what am I going to do with it? Like you open them up and it's just like, what am I going to do with this guy?
Well, actually, I wasn't a trauma surgeon, but I've done hundreds and hundreds of hip fractures.
Okay.
So for all your listeners out there, I'm just going to tell you right now.
Yeah.
Right? Here's the deal. Your bone strength peaks in your 20s.
Yep.
Okay? Earlier for women, for females, than for males.
Yep.
Right? And then it's downhill from there.
Yeah.
And the goal is to maintain so that you don't break your hip or your wrist or your back when you're an old person.
Yeah.
So weight-bearing exercises, calcium and vitamin D, like everybody should take this seriously. And men think they don't get osteoporosis, but they do. They just get it on average 10 years later than women. So the women break their hip in their late 70s or 80s, and the men break their hip in the late 80s or 90s, and they're more likely to die after the surgery. The men are.
Wow.
For reasons which aren't exactly clear. So I've taken care of all kinds of hip fracture patients, worked after I retired from Mayo and I went to Yale, worked on a fabulous integrated hip fracture program where we transformed clinical outcomes, some of the best clinical work that I've done. But in the pandemic, I was there in the pandemic, that was tough. Because we were only doing emergency surgeries then, no elective surgeries. So I'd be going in to operate on these patients that broke their hip and their families could not be with them. And that was I just found it so hurtful, even to me, it's like the surgeon, like it's hurtful to me that the children aren't there. I can't even imagine what it was like for the patient or the family. Yeah, that was a terrible time.
I've heard Dr. McCary, he was very outspoken about that, and he thought it was cruel. And I agree with him. Do you think that was about money? Do you think it was truly about protecting the staff, or do you think it was about money?
I'm going to go back to my high performance team analogy, okay? Like there was a lot we didn't know at the beginning of the pandemic. There was a lot of fear, and I was at Yale at the time, and we were the second wave out of New York. Like you guys got it here first. It came right up to Connecticut.
Right.
And we had people dying. I mean, it was very, very bad. It was serious, serious stuff.
Yeah.
But then as we look back, we say, well, like, were we given bad information? You know, was the research really solid? And having more diverse voices on that team to ask those questions at that time and not stifle, not cancel voices, right?
Yeah.
That to me was the flaw.
Yeah.
That was the fundamental flaw.
Agreed.
And if we had had that, would the same decisions have been made? Maybe. I don't know.
Right.
Right? But we would have had more confidence in the system and the decisions that were made.
Sure.
Instead, we have people like Dr. Marty Macari and Jay Bhattacharya coming out and being kind of some of the lone voices that had the courage and the ability, because they were in more protected positions.
Sure.
That they could question some of this.
Sure.
Yeah.
Yeah, and I think it's whether you're. I don't like the entire vitriol and social media, anti-vax BS. Like, let's just stick to the facts and the science, and let's agree that as Americans, we all have a right to all of the information, and then make your decisions, make your choices, point to the studies, but to just kind of take it on blind faith. And let's face it, it was a part of our lives that I hope in our lifetimes we never repeat, because it really was. Hopefully there's not another Great Depression coming, but it was kind of like our Great Depression. It was just, I was depressed. I think everybody was depressed. It was like, where's the sunshine? It was nuts. It was a really dark period. But I think why Dr. Makary is so outspoken is he was upset that we're just kind of meant to take what's stated by the FDA, the CDC on blind faith, and that's where I think his problem was, and that's where my problem is. Like, okay, but what are the studies? What are the facts? I don't think. So I had my cousin on the show. My wife's cousin is a physician's assistant. His name is Charlie DiMaggio, brilliant guy, worked for years in the ER at Elmhurst Hospital, one of the biggest trauma hospitals in the country, and then went on to work at Rikers Island and corrections, and now he's teaching at Columbia, I think, or NYU. Anyway, he's a very, very bright guy, an epidemiologist. Then we had a conversation, and we were talking about masks, and he was like, "Mass work." I was like, well, I don't think anybody should debate that mass work, right? Like, I don't want to go into surgery and see like the surgical team not masked. I'm pretty sure there's good reason for it. But then we started talking about, okay, but is the mask for your protection or is it for the protection of others? And what truly is the efficacy as it pertains to coronavirus? And that's a different story. It's a different question, right?
Yeah. And, Dr. Makary is just a brilliant guy and such an excellent choice to lead the FDA. So I'm very excited. I am confident that he will restore rigorous scientific-based processes at the FDA.
Yeah.
And not that they don't have some of them now, but again, we have to get away from these institutions that are supposed to be serving the public from getting caught in a political, the political wave, which changes.
Yeah.
Right?
Yeah.
Yeah.
So I'm going to switch gears here, and I do this often.
All
it's
right.
like a shiny object. So you talked about your upbringing and the fact that your dad was never around because he was providing for you and your 5 siblings and, working 5 days a week and then time and a half on Saturday and double time on Sunday. Guess what? That's what folks do, right? How did this kind of affect you? Because with all that you've accomplished and with being an orthopedic surgeon, and I'm sure that you didn't have kind of all the time in the world to frolic through the tulips. So how did you balance your time?
Well, when I was growing up, I studied. I worked at the house. After my older sister left for college, I would cook dinner most nights for my siblings so dinner was ready when my mom got home from work, and my dad worked 3 to 11. This is just the stuff you do. You come from a big family. Everybody's got to pitch in. Yeah. It's teamwork. Yeah. Right? This is how it is. Yeah. 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 So, but it's interesting, I read a study once when I made the national team in 1979, which was my first kind of really elite level accomplishment. I was in Princeton, New Jersey. We didn't have cell phones then. So I get to a payphone, which I call my parents to tell them I just made the team. And my father answered, and his response was, "Of course you did, honey." Okay. My mother got on and she was like, "That's wonderful. That's wonderful. I'm so proud of you." But later on, I've read in this kind of psychology literature that dads are so much more important to girls in terms of their ability to be successful, right?
Yeah.
Their support matters more than the mother. Now, not that I don't think my mother wasn't important or supportive, but this is what the psychologists will say.
Sure.
Right?
Sure.
And when I read that, it took me back to that moment when he said, "Of course you did, honey," because it was his unwavering confidence in my ability to achieve was exactly what he meant.
Yeah.
In that one phrase, in that moment, "Of course you did."
Yeah.
I always knew you could do it. I never doubted you.
Right.
Never doubted you.
Right.
And that's what I hope my husband and I have been able to bring to our children.
Yeah.
Right?
Yeah. Yeah.
That's what you need.
Yeah. That's where it all, that's really where the money is.
That's where the money is.
For sure. So you have this incredible career. You're a successful orthopedic surgeon. You're correct me if I'm wrong, you're chairing the department at...
I chaired the department at Mayo Clinic in Florida for 8 years.
Okay.
We had term limits.
Yep.
I had lots of amazing leadership roles at Mayo.
Yeah.
I was in the Mayo model, departments and higher level committees have a dyad structure, so a physician and an administrative leader. I was the medical director for philanthropy in Florida, so I got to help raise lots of money.
Yep.
And that was fascinating work because, people that have wealth are usually smart and very interesting.
Yeah.
And they had to work hard to get that wealth.
Yeah.
And they want it to go to something that matters to them. I love that work. I had an enterprise-wide role. I was the medical director for the Office of Integrity and Compliance, so I know more compliance than most physicians. And I am, in addition to being the chief medical officer at Vori Health, I'm also the chief compliance officer, at least for the moment, right? And I actually really enjoyed that work because I looked at my role is to say, how does compliance serve the needs of the patients and the practice? Where you have to balance, here's a regulation that we need to follow versus the risk and some of the regulation. Like you have to make a decision. Like at what point do you say, we're going to let the surgeon leave the OR and the resident or physician assistant can finish closing the wound, right? Is that okay? Like, where do we draw the line that the surgeon can leave or the surgeon has to be in the OR the exact entire time? Things like that, right?
And that would never even occur to me that that's even, that this is like good inside dope, right? I wouldn't even imagine to think about that as a patient. I would be like, all right, there's a surgical team. They're going to open me. They're going to close me up. Hopefully who's ever doing it is competent. But on the compliance end of things, you really have to have these conversations.
Well, that's because there were situations where systems, I'll say, allowed surgeons to have 2 operating rooms going at the same time with patients at the same time. And so they have been audited, investigated. That's a bad thing. And nobody wants that as a patient, right? You want to know that for the important parts of the surgery, your surgeon is there doing the surgery or supervising the trainee that's doing it, right? But for the stuff, the kind of the end of the case stuff that quite honestly your assistants can do just as well, if not better.
Sure. This is below my pay grade.
No, they're going to take more time to do it better. Right. And then you can go out because you're going to go talk to the family, dictate your note, get ready for the next patient.
Sure.
So it's just like you have to balance, we're going to do the right thing. At the same time, we have to drive the ability to have operational efficiency. Oh, why do I say that? My favorite Mayo Clinic quote, Sister Generose, no margin, no mission. everybody in healthcare has to make money. If you don't make money, you can't serve your mission. However, the second half of her quote that a lot of people forget, no mission, no need for margin. So you can't, healthcare, unlike other business sectors, has to stay true to its mission, which is, I'm here as a healthcare system to serve the community, or I'm here as Vori Health to serve patients.
Yep.
Right?
Yeah.
You can't, if you lose that, you shouldn't be in healthcare.
Yeah. No, for sure. So when you say compliance, is the is compliance more concerned about the legal implications of what might happen if a surgery goes wrong and a patient coming back and saying, I don't know if it's like a courtroom where there are minutes recorded in surgery and what happened when precisely, and I'm just spitballing here. I don't know. Like,
I'll give you an example.
Yeah.
So, let's take email. Okay. This was an area of a lot of discussion back in the day, right? Because I would have patients email me all the time, including one patient of mine who had 9 patents on your on your mobile phone. Okay, now he emails me, and I'm not supposed to respond.
Right?
How is that being patient centered? Now I don't respond by replying to his email with what we would call patient sensitive information. Right?
Right.
It would be something like, thanks for letting me know. When can I call you?
Right.
And the reason is because email is not considered a secure form of communication
sure.
for HIPAA, which is the privacy law.
Yep.
Okay?
Yep.
But to say there's a blanket statement
Yeah.
that physicians are not allowed to respond to email, I found not patient-centered.
Yeah.
Right?
Yeah.
So you have to figure out where's the sweet spot
Yep.
where you can accept some risk, make it manageable risk,
Yep.
right?
Yep.
Because that's what patient wants. Now, things are different. Now, electronic medical records have portals and messaging, and so it's a lot easier to communicate with patients through the portal, and you don't have to rely on email. There's not as much email happening, but hey, some people, they still like to email.
Right.
Yeah.
Right. I got you. So talk to me a little bit about what you think the state of the U.S. healthcare system is.
Well, you got the right title for your podcast, right?
Well, yes, it is broken healthcare, of course, and not all of it is broken. Of course, it's not. And I often say I don't think the physicians and the surgeons are the villains in this story, right? I think folks like you go into medicine for all the right reasons, and primarily it's to help people, right? I think that's the overarching kind of theme. But when I think that, we're now spending $5 trillion, it's a fifth of our GDP, or 20 cents of every dollar that we're spending, it's really, I don't think, I believe we're at a tipping point, and something somewhere has got to give. So I'd love you to share your thoughts on this.
So there's lots and lots of complexity here. And the way I kind of distill it down to I think the major buckets is the payment system rewards inappropriate behavior, inappropriate decisions in a fee-for-service world, which is traditionally what's happened.
Yeah.
Okay? And every hospital and healthcare system, this is a really important point, make their margin, again, they need the margin to survive, to keep the doors open, to serve the community. They make their margin on elective surgeries, advanced imaging, and procedures. Anything that compromises that volume hurts their financial bottom line. That's why we saw it in the pandemic, hospitals full of really sick patients, and the hospitals were hemorrhaging money, right?
Yeah.
So that's illogical,
Yeah.
right? Your hospital's full, they're really sick patients. You should be doing okay financially,
Yeah.
Mr. Hospital. Instead, you're suffering, and you need a bailout from the government, right? That's because they're full of sick medical patients, And the way that they make money is from elective orthopedic and spine patients, elective surgeries, advanced imaging and procedures.
Sure.
Okay. So they make that money on those elective procedures, those we'll call them service lines, to offset all the losses on the service lines that are not profitable. Pediatrics has never made money, right? Half the kids that are seen, children seen, are on Medicaid for children, which pays the healthcare system, the docs, very poorly. So you have things like that. You have infectious diseases specialists at the hospital. You got to have them. They don't make money. So you have all these parts of the system that you need to have a whole system that functions well to deliver the care that patients need, but only certain segments of them can make a financial profit. So then what happens? All the administrators are pushing these financially profitable segments to do more. So if you go to any healthcare system, I bet dollars to donuts that every surgical administrator has, as part of their performance metrics, surgical volume targets. Okay, and I'll just focus on surgery. Right? So now there's a target. Now, most people, surgeons, goal-oriented, they want to make their target. That will translate down into individual surgeon targets. So of course I want to make my target, right? But more fundamental so there's this pressure. There's this pressure to do surgical volume because that's what generates the margin that keeps everything afloat. Okay. I don't think that the surgeons as individuals are making decisions that are purposely like, Ray, I'm going to tell you you need an operation when it's not even reasonable.
Right.
Okay.
Right.
So having said that, however, surgeons, orthopedic surgeons, spine neurosurgeons, none of us are well trained in non-operative care. So we go into the situation looking at the surgical patient with a bias for surgery. First of all, we're surgeons, we're trained to do surgery, and we're not well trained in non-surgical care. This is why we see such a high percentage of inappropriate low back surgeries. And we're talking 50%. Inappropriate knee replacement surgeries, a third. Inappropriate hip replacement surgeries, 18%. Not as high for hips, but I mean, okay, almost 1 in 5. These aren't like small numbers.
No.
And it's not just the cost to the system that's an issue. Every single patient that has an operation is at risk of a complication.
Sure.
Right? There's no free lunch.
Right.
You can't be a surgeon and not have complications. You can't be a patient, have surgery, and not be at risk of a complication.
Right.
So the whole system is created around these incentives that are not truly focused on what's best for the patient. Because what should be best for the patient in the orthopedic and spine world is our model.
Right.
Okay? So here's the model. You come to see us as a patient. We're a virtual medical practice. It's very convenient. You get on Zoom with us. You have a video visit.
We're talking about Vori Health
We're
now.
talking about Vori Health
Okay.
now. Well, I can back up a minute.
Yeah.
How did I get to the Vori Health part?
Good question.
All right. So I'm chair of orthopedics at Mayo Clinic, Florida.
Yeah.
I'm looking at the data. How many new patients did my partner see last year compared to how many surgeries they actually did? Right? Simple kind of back of the napkin, rough calculation, rough metric.
Yep.
That percentage range from 15% to 40%. And I was the 40%er. I had a very mature referral practice. All the patients with weird tumor stuff came to me from other orthopedic surgeons. I had a lot of joints. So my yield, I'll call it surgical yield, was pretty high. Look at my partner at the 15% mark. Jesus, he's seeing a hell of a lot of new patients to generate his surgical practice. And remember, if you're going to be a good surgeon, you got to operate.
Sure.
You got to do cases.
Sure.
So I had the opportunity to hire another surgeon or a different model, which I proposed. So I go to the powers that be, and I have my secretary pull up, here's the list of patients that the ortho surgeons saw in clinic today, and here's rheumatology, and here's physical medicine and rehab. I mean, different groups, right, that see patients with orthopedic issues, spine joint issues. And I said to the powers that be, I want to pilot bringing a non-surgeon musculoskeletal doctor into our all-surgeon department. And I want this person to focus on we call the internal consults at Mayo. You come to Mayo for your exam. I, as the ortho chair, have to make sure you can get in to see us if you need to see us in 3 business days. I want this person to focus on these folks because rarely they need surgery.
Yeah.
Right? Let's try this.
Yeah.
Give me that is very disruptive.
Yeah.
Lots of pushback. Lots of pushback.
Right. And what were they afraid of?
Here's what they're afraid. The patient's going to come to your department, Mary, expecting to see a surgeon. They're not going to see a surgeon. They're going to be upset, and they're going to send love letters, nasty letters to you and to us. Because we took patient complaints very seriously.
Yep.
I said, I hear you. I hear you. Guess what? If the patient comes and they see this non-surgeon doctor in our department, and they express to us their disappointment, I know at the time, I will have a surgeon see them same day, next day. Right?
Yeah.
Because that's what we would do now. That's how we practice as a team.
Right.
If my partner saw a patient and they knew I needed to see them, I was the better surgeon, I was the right surgeon for their issue, then they call me, they page me. Hey, Mary, do you think you could come over to clinic? I'm in the OR. I'm like, I can hop over in between cases. I can probably be there. I can be there. Give me, if the patient's willing to wait an hour and a half.
Yeah. I'll make it happen.
I'll make it happen.
Yeah.
Right?
Yeah.
Or I'll see him the next day, something like that. So we just did this. So we piloted it. I had 18 months. I had 12 months to get the data. If people didn't like it, it ended up being a man that I hired.
Yeah.
Had 6 months to find a new job. That's
Okay.
the deal.
Right.
Right?
Yep.
So we do it. Absolutely fabulous experience. Great for patients. The other doctors in the clinic started referring to our department, specifically requesting this physician because they're like, don't need to see the surgeon.
Yeah.
Let's have them see the non-surgeon musculoskeletal doctor.
Right.
I hired a second non-surgeon doctor in the department. We then looked at, and that allowed me to get the surgeons into the OR one more day every other week, which effectively increased my surgeon capacity by 20% without hiring any more surgeons, right?
Yeah.
And the non-surgeons were almost half the cost of the surgeon.
Wow.
Okay, right?
Yeah.
So now,
numbers look good. Business people have to be happy.
19% improvement in my contribution margin from my department to Mayo Clinic, Florida in this model. A win, a huge win.
Yeah.
Patients, and the best part, right here's the best part. No, I'm serious. So when one of my non-surgeon partners had a patient they would want me to see that needed knee replacement surgery, the patient was all worked up, teed up, it was a beautiful thing. All the non-surgical care has already been done. I go in there for my consultation with them, the visit with them, and I can talk about the surgery. I can focus on what are your goals? What do you want to get? What do you think is going to happen if you have knee replacement surgery?
Yeah.
Are these realistic expectations? Let's really talk about the risks. You know what happens?
So you're able to slow the music down.
No, and get to the stuff that was really so important about the decision for surgery so that this patient could really make what I call a more informed decision and we could do more shared decision making in this process. It was so beautiful. So when I retired from Mayo in 2015 when I was recruited to Yale to build this a similar integrated musculoskeletal center. And when I realized that that traditional systems simply weren't going to change. Okay?
Yeah.
Because of they're trapped in this payment model that's dependent on elective surgeries, advanced imaging, and procedures to generate the financial margin. That when I come with this model that actually promotes more effective non-surgical care,
Yeah.
and only gets the patient to the surgeon when they really need the surgeon, okay, that's not going to happen in the traditional world,
Yeah.
right?
Yeah.
It's not that they're bad people; they can't do it. It's the Clay Christensen innovator's dilemma, right? So I then had the opportunity to kind of go entrepreneurial. And so Ryan Grant, who's my co-founder and our CEO, he's a spine neurosurgeon. My first year at Yale was his last year. And then he went off to Geisinger. And then he called me up later in 2020 and said, hey, thinking about starting this new company. What do you think? And because it was going to be my vision of this more holistic model in the telemedicine space. And I said, okay, let me think about it.
So he's basically thinking about taking your concept and scaling it.
Yes.
Essentially.
Yes.
Yeah.
In the telemedicine space.
Yeah.
And I said, okay, let me think about it. And it just so happened, there's another good story. So I have had the benefit of some incredible kind of executive leadership coaches in my career. And so one of the ones that I had, shout out to Maggie Carey. She's in the Washington, D.C. area. She's amazing. Anyway.
Hey, Maggie.
Hi, Maggie. Another interesting little tidbit. So when I first started working with Maggie, I was like, I'm not sure this is going to work for me. Because Maggie was always like, well, how did you feel? How did that make you feel? And I'm like, I don't really care how I feel, Maggie. I want to get to the goal. I want to accomplish the task. I want to win the race,
Right,
you know?
right.
But
Well, let me stop you. Sorry to interrupt. So
Yeah.
I just had Steve Napolitano on, and he's a life coach, and he's an amazing guy. And, you know, often people are at a crossroads, or they're kind of where you were at, you know, do I really want to do this? And he asks a very similar question, like, what will doing this, like, what is your vision? What does your life look like? And what will having this, how will that make you feel? So,
Yeah.
brilliant question,
Oh,
to think about when you're kind of trying to analyze, do I go right at this fork, or do I go left?
No, she helped me so much because as much as we think we make decisions based on data, and we do need data, data is super powerful, right? We still are so influenced by our emotions, right? And this is so true in the startup world, right? You go out there to pitch your new company, and what do you have?
Yeah.
A deck and who you are. And so the investor has to believe in you.
Yeah.
Which means they have to like you. If they don't like you, if they think you're a scumbag,
You're done.
You're done. Like, they're never going to give you any money.
Yeah.
Right? And
Yeah.
why would they?
Right.
Right. So Maggie happened to call me up kind of the next day, right in this moment. And I said, Maggie, it's amazing that you called me. She was calling to check on me. It was a pandemic, you know, and people were being, you know, very appreciative of what was happening to healthcare clinicians. So I said, I actually have this decision to make. And she, just like all good health coaches, she just gets right to the critical question. And she says, what are you afraid of?
Boom.
Boom, boom,
Yeah, boom.
boom. And now I have to call it out. And I said, I'm not going to make much money. And I am the breadwinner in the family. Okay?
Yeah.
I got a husband, 3 kids. I help my mom. I got kids on the payroll. I mean, like, I'm the
And you had a kick-ass career.
I have to pay the bills.
Yeah, sure.
So she says, well, are you going to be able to pay the bills with your startup salary? I said, yeah. I'll tell the children that discretionary spending needs to be curbed. By the way, that was an ineffective conversation.
You should have called me. I would have told you the
Yeah,
answer.
exactly. That was a waste. But I said, yep, we'll be able to pay the... She says, well, then what's stopping you?
Yeah.
And in that moment, I had the clarity. Like, yeah, I need... What else? This is my vision. I want to transform the delivery of musculoskeletal care to be more patient-centered, to get patients to surgeons when they need surgeons,
Yep.
but not sooner. I want to impact this ridiculous rate of inappropriate surgeries. I want to save money because it's not just insurers that are paying the bill. It's rising out-of-pocket costs for patients and families that force crippling medical debt. And people defer care because they can't afford the out-of-pocket expense. I mean, it's bad.
Yeah.
And I was like, yeah, this is it. This is This is the point where I'm now ready to go say, I'm going to leave the comfort and security of academic medicine where I've been my whole life, and I'm going to go into the big, scary world of entrepreneurship.
Yeah.
And boom, I did.
Here you are.
Here I am.
Amazing. I love that. And what I love about that is, and I've said this before, but we all have a winning lottery ticket to live in a free country and exist in this time, in this place where we're so fortunate and we have so much. And when you think about, our careers and some of the trials and tribulations that we go through when it comes to, do I go this way? Do I go that way? What's the outcome going to be? Life is really lived in those areas that are the unknown, where you have to take risk. And, you don't know what the outcome is going to be. And we're human. You make the best decision that you can. Sometimes it's going to work out. Other times it's not going to work out. But, it reminds me of the great Teddy Roosevelt speech at the Sorbonne in Paris. The man in the arena, the woman in the arena. It's being there. It's putting yourself out there and taking risk. That's where we live our lives. And so I really applaud that decision. And so tell our audience a little bit about Vori Health. Like, what is it that you do that folks should know about? And, I don't know if it's just corporate facing, if, you have to be a part of a group that offers this to your employees, or if you could be a person off the street and engage with Vori. How does it all work?
So our partners, our clients, are insurers, and so insurance companies and self-insured employers as a general group.
Yep.
And we have a model where we're built to do value-based contract pricing. So, for example, we have a contract with a self-insured employer that says we're going to take care of if your person comes to us, we will provide virtual musculoskeletal care to them for a year for this bundle price, and you're going to pay us in 3 installments because. What if we see after the first visit, we say, you know what, it's not common, but it does happen. Like, Ray, you're really not a good person for virtual care, right? Like, you have this big balance problem and you really should not do virtual physical therapy. You should go to in-person physical therapy. Or we have per engaged, per member month models. And we're just starting on our first big population health management contract that we'll be announcing probably in a few days.
Look at
That's
that.
Very exciting.
You can't give me the scoop?
No, I won't get ahead of it. I won't get ahead of it.
Good.
And that's like new work for me, right? Like, I've never done that. I like the challenge of new things and figuring out how we're going to do better. So our model basically focuses on patients having a care team that's always led by a physician. Again, the physician who's not a surgeon, but specialty trained in orthopedics and spine, mostly what they're called physical medicine and rehabilitation doctors. Okay, they have a physical therapist. They might also have a physical therapy assistant. We have a health coach. Health coach is very important. The overlap, Ray, for people with orthopedic and spine issues and mental health issues like depression and anxiety, super high.
Wow.
Especially for people with chronic conditions. You can imagine it. You got chronic back pain. Guess what? You get depressed.
Yeah.
Right?
Sure.
And so we need to be addressing these things on multiple levels. We need to be focusing on the things that patients can do that will help them get better, that, again, are non-surgical, like if I took people with back pain and I did nothing but improve their sleep, their back pain would improve. Now, when you go in the regular system, because you have back pain, does your doctor or nurse practitioner, does anybody take the time to talk to you about sleep?
Right.
And try to help coach you in changing your sleep pattern and behavior?
Right.
No. Why? Because nobody pays for the health coach.
Yeah.
In our value-based model, we can have a health coach, okay?
So it's funny that you mentioned that. So, part of the reason that I started a podcast is I'm a communications arts major. I studied broadcast, television production and filmmaking. I was thinking about going out to get my MFA and wanted to be Steven Spielberg. It's a whole other story. But, growing up, I listened to a lot of talk radio, a lot of late night TV, Johnny Carson and Letterman, and, there's some of my heroes. And in my, I guess, late teens, I started listening to Howard Stern, who's a brilliant interviewer. And he had a childhood friend named Dr. John Sarno, I think I'm getting that right, who wrote a book called Healing Back Pain. And I had some back pain. So as a young homeowner, I was wrestling with a cast iron radiator that probably weighed 100 odd pounds. And it was awkward. And I sat on the radiator, and there were two bolts on opposite ends of it. So if you could imagine, I had a wrench in one hand and a wrench in the other hand, and I went to do this, and what wrenched was my back.
Yeah.
And so I looked at myself in the mirror, and I was literally crooked. And so I went to chiropractor for a while, and this and that and the other thing. But the gist of the book is, in reading the book, you heal yourself. It might sound crazy,
no, it's
but
not crazy.
It's a mind-body connection, and we all have stresses in life, right? And so the thinking is, your mind will cause you physical pain to distract you from stuff that's stressing you out, right? In a nutshell. And, I've told people this story, and they're like, "You're nuts, right? Like, that didn't happen. You healed and blah, blah, blah." So, yeah.
All our clinicians are trained in what we call pain reprocessing therapy. It goes like this. People get chronic pain. It causes actual physiological, biological changes in their pain pathways, the nerve pathways up to the brain.
Yeah.
Okay? And so you have to work on how to get them to think differently about pain to help the brain rewire the system while you're also working on, okay, let's improve your sleep. Let's talk about an anti-inflammatory diet. Let's get you doing some home exercise program, right?
Yeah.
Maybe you need some medicine that our physician can prescribe.
Yeah.
Maybe you actually need advanced imaging.
Yeah.
Maybe you don't, right? But let's approach this from a much more holistic standpoint, because there's so many other things that are going to improve the chances of you getting better without having surgery. We are not anti-surgery, right? My co-founder and I, he's a spine neurosurgeon. I'm an orthosurgeon. We know surgery works, but but you should have the right patient. So we're not anti-surgery. We're just anti-inappropriate surgery.
Right.
And so we found it's been very rewarding. The care that we've been able to extend to patients in this more holistic model and how they've improved, and patient stories. I mean, it's that's what fuels me.
Yeah.
Yeah.
Yeah. Well, it's like to a hammer, everything looks like a nail. Right. And so to a surgeon, everything looks like surgery. And that's kind of their default. It's their training. But I love the fact that we're not anti-surgery, certainly. I mean, how many people have you helped with those hands in your medical training? A lot. But what I think I'm hearing you say is we shouldn't perform surgery until it really is indicated that surgery is necessary.
And the other thing that I find so rewarding is that we're helping, particularly self-insured employers, right, save money. Because, and insurers, big insurance companies too, because people have to realize that somebody is still going to pay the bill.
Yeah.
Right? And that's either going to get passed on to that employee as higher healthcare premiums, higher deductibles, something that's going to impact that individual and their family. And we have to start being more responsible and understanding how we're going to rein in these healthcare costs.
Yeah.
Right?
And what I'm hearing is that at Vori Health, it's kind of precisely what you're doing, right? Because it's not about throwing more money at the abyss that is the healthcare expense. It's about saying, well, as a self-funded employer that is really obligated at this point in the same way that they're obligated to adhere to spend their 401k dollars, and be fiscally responsible and be a fiduciary of those benefits. The same thing now applies to healthcare. And so in implementing something like Vori Health, they're really following through on that fiduciary obligation to spend plan dollars wisely, because they could find themselves in the black, avoiding tens of thousands of dollars that otherwise would go out the window towards a surgery that is not necessary. But beyond that, what's the other benefit? The other benefit is their employees are back to work sooner. They're happier. They're basically feeding their culture by doing something that is fiscally responsible, but also morally responsible.
Correct. And, in my experience interacting with these folks, they want to provide good medical care services to their employees, because they know their employees are what produces the product or the work that allows them to be successful. So they got to take care of their people. They want to take care of their people. But they also see these rising healthcare costs. And MSK, musculoskeletal, is always a number one or a number two spend for self-insured employers, and almost always for big insurer. It depends on the population.
Sure.
A younger population, you might have OB costs be a little higher, but MSK is always right up there.
Yeah, for sure.
Yeah,
so listen, Mary, we could go on for hours, maybe days. We have, just there's no shortage of things for you and I to talk about. But I think we're going to wrap things here. But I do want people to know how to find you. Is the best way LinkedIn?
So they can find me on LinkedIn. Absolutely. Particularly if you're interested in learning more about our solution. Reach out to me. I'll connect you with our growth team. And, we want to, our goal is really to transform the delivery of musculoskeletal care to be patient-centered and driving value. And driving the value is for the patient, and it's also for whoever's paying the bill.
Right.
Yeah.
And it's extremely valuable. If you're one of our listeners or viewers on YouTube and you're in this bucket where, you have knee pain or you have back pain or you have hip pain, the default shouldn't be surgery, right? It should be, certainly consult a doctor, consult a surgeon, but then maybe, trust and verify. See if there's something that you could be doing. Maybe there's an intermediate step that you could take. And maybe surgery is inevitable, but it might not be necessary today. And your company, Vori Health.
Vori Health, VORI. V for victory.
V for victory. Coming from an Olympian, ladies and gentlemen. So, that's tremendous work. And what an honor it has been to spend some time with you. Thank you for being here.
Thanks, Ray. It's been a pleasure.
Oh, awesome. All right, folks, until next time, love always. Take care. Bye.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.